Welcome to the Autism Central podcast, the home of real stories, honest conversations, and shared wisdom from England's National Autism Peer Education Programme. Here, we bring together autistic people and the people who love, support, and care for autistic people of all ages and backgrounds to explore every aspect of life. The National Autism Peer Education Programme is delivered by Anna Freud and commissioned by NHS England. Through education, coaching, and connection, we offer resources, group webinars, one-to-one peer support, and community events that centre lived experience and build real understanding. Our vision is a society where autistic people, their families, and those who support them are empowered, connected, and thriving. This is your space, your community, your podcast. Welcome to Autism Central. Joining me on the podcast today is Dr Alison Lennox, who is one of only a few UK psychiatrists exclusively focusing on adult autism. Alison offers private autism assessments for individuals aged 17 and over, and her approach combines clinical expertise with a compassionate understanding of how neurodivergence shapes part of everyday life. Alison studied at the University of Cambridge, where she completed her undergraduate degree before earning her medical degree at University College London, and she undertook her psychiatric training in Oxford. She previously served as clinical lead for an NHS adult autism diagnostic service and contributed to the National Autism Training Programme for Psychiatrists, where she lectured on the topic of diagnosis, helping to improve standards of care across the UK. And Dr Alison is also an active member of the Executive Committee of the Royal College of Psychiatrists Neurodevelopmental Psychiatry Special Interest Group. Welcome, Alison, and thank you for coming and giving your time today on the podcast. As one of only a few UK psychiatrists who focuses exclusively on adult autism, I think your insights and experience are really going to help demystify the whole autism assessment process for our listeners today, but there's no pressure. Where I want to start really is for those people who are listening who might be considering an autism assessment either for themselves or for somebody that they love and care about, and to explore with you what an adult autism assessment is actually designed to do and what are some common misconceptions about it.
Sure. So that's a good question. And I think it's something that isn't as immediately understandable as people might think. So when I started assessing adults for autism a number of years ago now, I think I thought in a rather sort of autistic way that you were trying to work out if somebody was autistic or not. And of course, you know, as a psychiatrist, when you work with mental health conditions a lot, that's often what you're doing. And I think, you know, what I've kind of learned from experience is that trying to explore somebody's neurotype to answer a question about what you as a different person thinks it might represent, as a person perhaps with more expertise in, you know, shuffling the cards and seeing how they fall, is that actually whilst an autism assessment is designed to, of course, to determine if a person's experiences add up to being autistic or having traits of autism but not technically being autistic, or not being autistic, or actually having a different divergent neurotype, or having a sort of co-occurring mental health condition, that actually I think the real point for most people is to have the opportunity to meet somebody who you believe has the right set of skills to sort of safely hold your story and validate it, whatever it might represent.
Yeah, it's interesting that you use the word safe there and story, because, and again, maybe this is myths and stereotypes that exist out there, but you wouldn't often put psychiatry with safe and story in the same sentence.
No, you might try to run away from them. So I think this is really, really important. And I think my understanding of what most people really are seeking when they really put the emotional commitment into thinking I'm going to try to get a view on who I am in this way is something that is, safe and validating, but also something that is accurate. And I think that's the real crux of it, is that you want to have an experience that allows you to share your story in a way that it can be heard, but also to be able to rely that the personal people who are helping you or your family member are going to give you a really accurate, you know, opinion, and that opinion isn't just a yes, no, but actually it's more of a formulation of, what your sort of profile is, whoever you are, and what's going to be useful for you. And I think some of the misconceptions that I'm really struck by is and you see this a lot on social media. I'm sure you might agree that a lot of people have to often wait so long for assessments that people say that they're waiting for their diagnosis, and it makes my brain glitch a bit, because I sort of think, no, you're not waiting for a diagnosis, you're waiting for an assessment, and if you're waiting for a diagnosis, there's a real possibility that you're going to be quite wounded by what's ahead, because it may not necessarily feel like the assessment you had imagined if you receive a diagnosis, or you may not receive a diagnosis. So I think and you hear it with, MPs talk a lot about how many people are waiting for diagnosis. I think that's quite unhelpful. And I think one of the other misconceptions, I think, is that there's a sort of a gold standard autism assessment. You hear that phrase a lot, don't you? But given that there's no set way that an autism assessment could be conducted, there isn't really a gold standard. And I think that's really confusing for people. And I think also there's something about the care that needs to be taken with understanding what an autism assessment might be and what it might not be, in the sense that, for instance, when patients are assessed for ADHD, a different but co-occurring divergent neurotype, the diagnosis is often very important, but it's a means to be able to access a trial of medication that may reduce some of the sort of features, perhaps. And I think one of the things that's tricky about an autism assessment is that sometimes it doesn't go beyond that, or it doesn't go further. I think, particularly if you've waited a long time or you've thought about it a long time, you can have a sense that life is going to change, that there's going to be a sort of kaleidoscopic shift at that moment. And I think that can be quite difficult for people to manage. Certainly I hear that a lot.
Yeah, you've touched on quite a few things there, and we're going to unpick what an autism assessment typically involves, and go behind the scenes of some of that. But some of the things you've touched on there, as you were talking, Alison, about, there is a fear that everything is building up to this one person that you're going to sit in a room with, and they are going, or on a screen, and they are going to say yes or no. And the fear of, I often hear this from other people, that they will put off going to see somebody to have an assessment because of the fear that they are not going to be seen. And we're going to touch on some of that as well, aren't we? About masking in an assessment, and how we get around that. And this idea of diagnosis, that, you know, you are still autistic, even up until the point that you go and sit in that room for that diagnosis, that, up until that point, if that assessment comes back saying that you are autistic, you've had a lifetime of being autistic. It's not the point at which somebody says you are that you all of a sudden become autistic. You are autistic. Somebody left a comment actually in my on my book saying, she's only recently, in the last couple of years, got a diagnosis, and she's written this book about late discovery, and almost as though I'm not qualified to write a book about my experience of being autistic, and yet I've had 4+ decades of being autistic. I just didn't have the words or the narrative or the frame to put around it. So this idea that you only become autistic at the point of diagnosis is one, I think, that you touched on there, that is out there, isn't it?
I feel like sometimes I'm quite a sort of countercurrent person, but I I do think from a societal level, understanding diagnosis is important because unless we count people, there won't be any support. As you say, the funding for good initiatives or well-staffed teams comes from knowing what people believe the need to be and then being able to meet it. So whilst I'm not very keen on a medical model, I at the same time I can understand that there's something quite important in terms of being able to continue to offer services. When I started assessing for autism in adults, the services had very few people who came in very short waiting lists, and of course that's about what we thought, I guess, autism was, but that makes it all the more important to try to capture sort of what we can as well, so that there is support.
Can you walk us through what a, well, we're not going to use the word gold standard here, but what a comprehensive autism assessment, what that would typically involve in a way to go behind the scenes of this process for our listeners today?
Sure. So I suppose if you think about it, being autistic is about having an experience throughout your whole life where your social approach is perhaps different in some ways, and also you show some specific behaviors that majority of people don't do, but you do, and kind of putting that together and sort of working out, do you have a profile that fits with autism? But of course nobody's autism is the same, and that's where it becomes trickier. So assessments are generally often standardized, but what if you break it down a bit, it's actually not that difficult. So when you think about autism assessments, you hear all these things beginning with ADI, ADOS, or DISCO. You hear all these things, they're just acronyms, and that doesn't mean anything. But actually what people are actually trying to do to explain is that the most important thing, I believe, is that you're trying to hear a person's story. And a psychiatrist or psychologist, would call that sort of taking a history. So actually exploring somebody's experiences, going back as far as they can remember. Um, and what you're doing when you're doing that is trying to look for clues. I mean, it's detective work. You're trying to see if you can anchor the sorts of experiences they're describing now, sort of as little anchors throughout their life. So the first perspective you have is what the person you're meeting brings. The second perspective you might have is an informant perspective. That's what they sort of typically call it. And that's where you ask somebody like a parent or a loved one, sort of what their views are. But obviously that's something that most people with common sense would give slightly less weight to than somebody's own, experiences. And then the third thing you can do is you can kind of try to sort of more formally consider what your own observations are of somebody compared to your clinical experience of meeting lots and lots of people who are not autistic. So basically, you have sort of three perspectives that you're trying to triangulate, if possible, and they're not all necessary, but the one that's definitely necessary is what the person thinks themselves. And so you need to have their perspective, perhaps an informant perspective. That's really important with youngsters, but less important as people are older. And then you might sort of also triangulate in your own kind of impressions as well. And all things like ADI and ADOS and things, these are just more structured ways that you can sort of lenses that you can look through, through an observer's view or through your own view. But the guidelines are actually very clear that you don't need to do any of those things nowadays, that they could be useful in more complex assessments. But what you're really trying to do is to triangulate as many sources of information as you've got, so that you can sort of try to form the best opinion, I think.
And I suppose as an adult, that's where, for people listening, they might be listening to this and thinking, right, well, I'm an adult, and if I think about informants, I don't have anybody in my life who could be that informant, or perhaps they, as happens with many families, they don't have a relationship with their parents, their siblings, or maybe even the idea of bringing autism up into the room as a conversation. It opens up an enormous Pandora's box, doesn't it? Of, I can't just ask them to become an informant. And what often I will hear from adults going through this process or thinking about this process is the additional invalidation that comes from taking this to parents or siblings or people in their life and them saying, but I do this. I do this too. You're not autistic. I'm not autistic. We don't want this label in our family. You need to shut this down.
Yeah, so I hear that a lot. I think a lot of people contact me to discuss what an assessment might look like for them. And I'm always very clear that whilst these are pieces that we can use, that I don't think that there's much personally, I don't think there's much clinical validity with adults in asking somebody to ring up their mum and ask if they can be quizzed on 200 features that they didn't notice their child showed between at the age of 4. That's just going to bring up a lot of disharmony and very complicated feelings for both people. And also, in experience, the main reason that I tend to find that sometimes informant histories are not necessarily reliable, even if they're offered, is that very often people who are seeking an autism assessment have parents with neurodivergent traits, and therefore, as you say, their family normal is one that is a bit more lively. And so therefore asking about difference, it's not going to pop up in that way. Um, I think I mean, I see that more as a bonus if somebody wants to provide an informant history, but I don't mean a bonus really for me because I can do my job regardless. I mean a bonus for the person, that if they feel that there is somebody who they feel supported by, that they would like to contribute, and that lessens their anxiety on the day because they feel they've given the most comprehensive account, or it takes some pressure off them explaining. That's very helpful. And I think I tend to see it more often in my work where somebody might bring an informant to an assessment, not with a major focus to think about their, childhood presentation, but actually just to support them to share how they might sort of experience things today, in their adult life, to take a bit of the pressure off the information sharing. That's really helpful. But I don't mind if somebody brings their boyfriend, or their therapist drops me a line or something like that. There aren't really rules around these things. And I think that if an assessor or a provider is being very inflexible about these things, I might be asking questions about it, because that's not really in the spirit of reasonable adjustments if you think about it.
Yeah, and it's knowing what those red flags are, aren't they? Of knowing what doesn't sit okay. But as you were talking there, it also made me think about the intergenerational impact of an adult autism assessment. And when perhaps a child, even if that child is well into adulthood and fully independent in that sense, the impact that that can then have on you as the parent or the grandparent of then this coming into your life and realizing actually this is also me and this is also maybe my parent and their parent, and it goes on, doesn't it? And on and on. I suppose the question for me is how would you support that, Alison, in your clinic if one autism assessment then is opening up this door to many other realizations for other people who might be in their 70s, their 80s, their 90s, beyond. What support is there, and how would you handle that?
I don't think there's a clear answer, because I think families respond to this sort of thing quite differently. There are a lot of people that I meet whose families sort of identify with some of these things and might perhaps want to explore their own assessments, or these sorts of things, and go back and look at the family videos together and notice all the stimming and these sorts of things. But there are also people who I think have the experience that once they share the news that they are autistic, that sometimes might make them feel a bit set apart from their other family members. That whilst they might, for instance, see some traits that's not sort of welcome. And I think that's often due to the fact that the person seeking assessment has probably spent years and years wondering about this, whereas the person who hasn't thought about it might feel a bit affronted by, a new way of thinking.
Yeah, it can be quite othering, can't it, for those people? Just going back to the actual assessment process. So you've talked about the elements, the story, the informant, the story that you're looking at of what's in front of you. typically then, how long does an autism assessment take? How is it typically done? Do you have to go in person? Is it done? Can you do it on a Zoom screen? Talk us through a little bit of that.
So traditionally, an autism assessment would be quite a long, drawn out process over lots of sessions and involving lots of clinicians. But this is really historical, not pragmatic, in the sense that, like NHS services for assessing for neurodivergence were set up in really good faith in a really multidisciplinary way. So you would have speech and language, OT, perhaps a psychiatrist, some psychologists. And so traditionally, the model was that you would be assessed over several sessions in a multidisciplinary way where you would do different pieces with different team members. And obviously, the advantages of having input from different people is they've got different perspectives and different skills, and you might be able to find people to sort of pair to the client who are particularly going to be a good fit. But actually, nowadays, most assessments in the NHS for adults are done by a solo assessor, and this is really because of resource, but also because it's not usually too difficult in the sense that a psychiatrist or psychologist is used to normally assessing one-on-one. And normally what they would have is have some level of sort of team discussion, and then have multiple people where there were more complex cases. Now, my understanding about children's psychiatry at the moment is you're more likely to have a multidisciplinary assessment, and it's more likely to be over different sessions because children have less attention. But in terms of kind of what the so who it might be, you could be assessed by a psychologist or a psychiatrist, speech and language OT, a nurse even, but it depends. They're all valid, and I think there are different people who have different strengths for different sorts of assessments. And traditionally, they've always been done face to face because think about it, you're trying to think about how somebody might relate to others, and therefore the most easy way you can do that as an assessor is to have the experience of relating to them and seeing how that works. For me personally, I find it quite hard assessing people remotely. I did it during the pandemic, but I felt a lot more anxiety about running over it again and checking if I had it felt right. But I think what we find increasingly is that there are a lot of particularly right to choose providers who offer online assessments. And I think there are some people who that's a less good idea for, in the sense that there might be reasons that it would be easier for a person to meet somebody face to face and to know what to expect. And but there are also other reasons why it might be harder to, get on the bus, try and find a medical location, all the stress and overwhelm and sensory stuff, and that actually doing something privately one evening might actually be a lot more suitable for you. So I think there are sort of pros and cons really. And as I said, there's not really a set way, but I do think people sort of suggest there is. I don't think people dispel that myth very well, and actually, I think clinicians, whoever they are, need to just be, and teams need to just be a bit more upfront that we're trying to use our skills to do the best to understand somebody and to make it collaborative and to make it meaningful. But there are different ways that can be done, and actually, I think the most effective assessments I've probably ever done, even though I like to stay on script, is actually where it's a bit more bespoke for what somebody needs.
Yeah, I like your description though of it being a process of, this is detective work, it's triangulation of taking all of this information, and actually it's hugely weighted, isn't it, to the individual, the person in front of you, and really thinking about bringing as much as you can to your autism assessment. And how do you let people know that they can bring, because you presumably, Alison, you want people to be able to bring as much as they possibly can to an assessment. I remember sending my assessor a 60-page document on why I thought I was autistic, and it was all themed and categorized. And I thought, well, if that was evidence in itself of, the amount of time it has taken to put all of that information together. Would you be welcoming of something like that if somebody was to come with a folder, color coded?
First of all, I encourage it, but also that just absolutely makes my heart sing. That's just wonderful, isn't it? And I think there are people who would find that challenging. Perhaps a less experienced clinician might find that as a bit challenging. Hang on, I'm doing the assessment, not you telling me. Do you know what I mean? But actually the richness of it is that you've been able to get a window into somebody before you've even met them. um, it's very exciting when somebody provides that, and actually a lot of people do, and as you say, it's often quite extensive. But equally, sometimes somebody might just bring some little notes they've written down that are important to them, or some photographs to show me, or something like that. It doesn't have to be something brilliant, but something that they choose to share has a very high valency in my mind. And I can think of, patients that I have assessed who've, for instance, contacted me saying, "I'd really like you to explore this with me." And then we've met sort of 6 months later because they've really wanted to finish their thinking and sort of round it off before we begin. I think that's lovely.
And what about those people who have moved through the world who have really had to mask the version of themselves through for all sorts of reasons, but mainly for safety of being able to show up in a world and to feel safe. And you think about then stepping into a room with a psychiatrist or a psychologist or speech and language therapist, but a health professional. You're going to step into a room with a health professional, and you are going to expose your story for the first time to somebody. And you might be somebody who has had lots of experiences with health professionals in your life where you haven't been heard, or you've been misunderstood, or you've been dismissed or invalidated, or somebody's told you, no, that's not right, even though it's your experience that you're talking about. So, if we think about for those individuals who have lived in the world in that way and have those experiences, then the decision to come for an assessment and potentially that happen, you're already in a state of fear. So you're going to be even more masked because it doesn't feel safe. So how would you take into account that kind of presentation? But also, how would you make sure that, a bit like coming on a podcast, how do you make sure you create an environment for somebody to be able to come on and tell their story and explore things and make it comfortable and have accommodations? How do you do that?
So I think I'm in a lucky position that I work in private practice at the moment, which means that I can do things the way that I think are right. And that means that I can help people to decide whether they think that I would be their right assessor for them. So already before I start, there's a level of connection and, safety that's important, and a lot of time spent kind of orientating in terms of what to expect, what might happen, what they might need. So I think going into it like that can be very, very helpful. And I know for people who come to see me, they often have heard me speak on a podcast or something like that, and they already feel like they know me a little bit, which is a massive heuristic shortcut. Um, but I think that you can similarly prepare yourself in a way to know who you might expect to be meeting. So, usually, for instance, NHS teams will have some information about the different assessors on their websites and things. And I think that's really important to start to imagine what it might be like, and also I think to accept, and this is something that took me by surprise personally, to accept that it's probably not going to be how you imagined, but how will it sort of still be safe? And I think the way that good assessors make an autism assessment feel safe is by just having that natural curiosity in people. Because if you really care to try to understand someone and to be alongside them as you are working through what on one hand is compassionate, but on the other hand is super rigorous, and to be able to do those things in tandem, I think the thing that helps you to navigate masking and intersectionality and things like this is not to necessarily know all about somebody, because you won't, because you haven't, only they have that experience, but to really listen, to really listen.
What you said there about being alongside somebody, I mean, that is the difference, isn't it? That is the difference between the other experience then, that is this power dynamic where actually, you've got, and we talked about this earlier in the podcast actually. I think it was with Joe Feaster, who came on and was talking about the experience of being in a room with a health professional who, it was very much that I'm the expert, this is my experience, I hold all the skill. I'm here to validate you, not the other way around. So hearing you talk about being alongside somebody and being curious, and these things really matter, really, really matter for people.
I think something that I would advise people to do is that if you're in whichever setting you're approaching an assessment, I think it's very reasonable to ask questions beforehand about these sorts of things, because I do think that you can tell quite a lot if you ask, your local team or right to choose provider, just want to, check how do you sort of navigate issues like masking, etc. Because the responses you get are going to tell you the answer that you need about what it's going to feel like, I think. But I think a lot of people worry with masking that, like, it's that sense, isn't it, that sort of, well, hang on, I do this all largely subconsciously, so how am I going to somehow reveal myself in a way that ticks diagnostic boxes when I don't know anything else but to be me, and the less safe I feel, the more, scaffold will be around me. I think the more faith you have in trying to use that encounter. Like, it's very stressful, but I think the more faith you can put in it, the more yourself you will just show.
When at the beginning of our conversation today, I didn't even ask you the question about what is autism, but you gave me a definition, your definition of what autism is.
Well, it's not mine, Catherine, that's the diagnostic definition.
But the way that you talked about it, the language that you put around it, that's the definition that you were saying what autism is, and you said it in a way, you used language in a way that was humanizing. And when you were talking about, what questions to ask your local team or your right to choose provider, I mean, that is a really good question to ask, isn't it? What is autism? Can you tell me what autism is? Because actually, what you will get back from somebody is either a very humanizing version, or a very deficit laden version that gives you an idea and an indication of potentially what you're stepping into. Because I think it's a conversation we need to have, that, you know, there is harm that happens in assessments. People do have experiences where they come out of an assessment, and either the way that autism has been framed to them or the language that has been used, people come out feeling like they are a lesser person than the person that they went in.
I think that can happen certainly in both ways. It can happen if you receive it. There are lots of people who receive a diagnosis of autism, which may have been a goal, they suspect it, they'd like it established, and yet they come out of an assessment feeling really sort of hollowed out and misunderstood, even though that conclusion has been reached. And that's really uncomfortable when it's sort of what you were aiming for, but it doesn't feel right. I think that's a really uncomfortable experience. Let alone people who don't receive a diagnosis, and for whatever reasons that might be, whether they, aren't autistic, or whether they aren't autistic, but what their difficulties might represent wasn't, you know, framed in a way that brought them any meaning at all. So I think that's sort of really important to think about too.
Yeah. And what about the after part of a assessment process? What happens, whatever the outcome, whether it's a yes or a no? I mean, you've just alluded there to different experiences when the answer is yes and when the answer is no. And some people might not want to have the answer as yes, and some people might not want to have the answer as no. Everybody's different, aren't they? And very individual in that sense. But what happens after a diagnosis? Because again, often people will say, I'm going to go for my diagnosis and then I'm going to get some support. And there's this expectation, this very loaded expectation that this diagnosis is going to change everything. And what happens after a diagnosis?
Well, I think I'd actually counter that you need to be in the mindset, particularly if you're waiting for months or years, that you're going for your assessment and you might receive a diagnosis. I think it's important to understand that whatever the outcome, it's just an opinion. This is not somebody determining who you are or making a judgment on your identity. And if you do have an autistic neurotype, that's a really important part of you. That I'd hope that for most people, having recognition there would be validating and would enable them to move forward in their life with more self-compassion, for example. But I agree with you that if you do receive a diagnosis, post-diagnostic support can be quite limited in the UK at present, although it is building, such as this podcast and the Autism Central initiative. So generally in the NHS for adults, after an assessment, local teams would offer a sort of psychoeducation program. So I say psychoeducation very purposefully, meaning this isn't therapy. There's nothing to, there's no psychological problem there of being autistic and discovering you're autistic, but it's about providing support to explore different sort of facets of what your identity may be. And that's normally run in groups in the NHS for capacity reasons primarily. But it's about starting to take those next steps and in a way that's facilitated so that it feels, I think, comfortable. But a lot of people I know would decline the option to proceed to that because they would find groups uncomfortable, for instance. So that becomes a bit more tricky. I think a really important thing is actually about, because post-diagnostic support varies by area. Two things. The first is that a lot of people who are autistic, who find out they're autistic, have experienced or are experiencing co-occurring, mental health difficulties. And the way that service is set up is that those features would be, managed not by a specialist diagnostic team, but by, the specialist sort of mental health team. And I think in our country, we're at a bit of a crossroads at the moment where we're suddenly realizing that siloing off neurodivergence set in a separate part of the building, say from mental health care, can really shoot people in the foot and make it difficult to access the right support that they need, because actually their needs are more complex and they need to be looked at more coherently as a person. I think one thing that we can all work on, and for clinicians in this area, is about the quality of the reports that we produce to people, because I find that a very important bridging step for people I see. You come out of an assessment, it's been long, it's been intense, and you're likely to feel exhausted for a long time. And I think there is something that could be so beneficial about promptly receiving an official sort of synopsis that that, yes, records your experiences, but more than that, actually explains your profile and who you are and frames your experiences. So it doesn't just say, deficit, deficit, deficit diagnosis, but it's actually saying these are the things that we've talked about and here's how it all fits together. So that you've got individualized recommendations, what you discussed with that person, you're reminded kind of where your next steps might be. And I think there's a real difference, isn't there, between people who tell me that they have an assessment and then receive a more sort of template feeling report, and when somebody feels that there's almost a connection through the words.
Yeah, it really matters. It really matters. And if you think, we've been talking about safety a lot, but if you think that as a patient, as an individual, you go into an assessment process and you are going to be in that kind of survival mode, thinking, feeling, and you're not going to be taking in information. Everything's a bit of a blur, isn't it? It's like when you do something really scary, you go and talk somewhere and you can't actually remember what you said until you watch back what you actually said and how you spoke. I often feel like that sometimes on this podcast. It's only in the listening back that you realize the conversations that you've actually had. So it's so important to have that synopsis or that summary as soon as possible after an assessment has taken place, that doesn't just say yes or no, doesn't, like you say, doesn't follow some kind of template, that really captures your story and what you discussed, because you need it in the aftermath. You need it to be able to bring yourself back to. You might not have remembered a lot of what you talked about.
I think there are a lot of really good autism assessors in the room, but because of the constraints of their practice models, their reports don't reflect the care that they showed. And I think that's very confusing. If you feel you've had a very, often people do feel very connected in an assessment. And I think that that needs to flow through and build that sense of connection so that the person reading about themselves trusts what you have inferred about them. Because a huge part of it is about trust. Do you trust this person that they have reached the correct outcome? And do you trust that they have heard you?
There's two more questions I want to ask you, maybe three. I hope that we've got time to do that. One of them is around the co-occurring things that come alongside autism, and you've alluded to some of those. But I want to pull out one of those, and that is trauma. So, I'm sure many of the people that you assess will have a whole lifetime of cumulative trauma that sits alongside being autistic and is part of being, part of, I suppose, of how you experience the world and how the world responds back to you in that way. How do you differentiate as a psychiatrist, Alison, between what is trauma and what is autism? Um, there's so much out there, isn't there, on social media of people will say it's just trauma. It's just trauma. People are all of a sudden saying that they're autistic or saying that they have ADHD or a mixture of both. But really, it's just trauma.
Yeah, well, trauma doesn't make you collect Lego, does it? I think there's a lot of I can see how there are intersections in a Venn diagram, but there are also the other sides that don't connect. And what you can do very simply is explore the richness of all the other pieces that have no connection at all as starters. Often you can find somebody fully meets the diagnostic criteria without even looking at anything that overlaps. If you're systematic about it. I think the trauma narrative around neurodivergence, particularly autism, I think is really harmful because I think so many people, I think, are put off from seeking an assessment on the basis that they recognize they've experienced successive traumas in their life. And they therefore often sort of cancel themselves out from being entitled to explore their neurotype, which I think is really, really harmful for a lot of people. It is the case, I think, historically, when we didn't know so much about these things, particularly in women, that people would say, is it autism or is it trauma? And I think if anyone's saying that nowadays, they should check themselves, because that really, to my understanding, came from when we would talk about the sort of trauma of Romanian orphanage experiences where little babies would grow up not making eye contact or not wanting touch and things like that. That's very different to somebody who's just gone through their life but has experienced more usual, traumatic incidents throughout their life or protracted experiences.
My final question to you today, because I'm really conscious of time, is for any parents, carers listening, or even autistic people themselves who are listening, and we hear this so much, people will say, what is the point of having an assessment? Why give yourself that label? That label is not going to change anything. Why do you need a diagnosis? What do you say to that, Alison?
I think people have all kinds of different reasons why they would seek an autism assessment, and you shouldn't make an assumption about what that might be. I think it's, to my understanding, so I work particularly with adults, and so that's technically late diagnosed. And I think there's a real difference between what it might mean to a family of a neurodivergent child who's young, who's misunderstood at school, who doesn't have support, versus what it might mean to somebody in adulthood. But I think what I'd caution actually is that I don't think there is, as far as I can reason, I'm not sure there's a better time to be diagnosed, because late diagnosis involves a lot of looking back and reprocessing. But being diagnosed very young often means that you reach adulthood, but you don't really know what your autism is because you received that outcome when you were 5. Like, it doesn't have meaning. You can't make sense of yourself. I think people, if they feel that they want to explore it, they should, and not feel that you have to answer to other people or particularly disclose it or explain it or educate people, but just know that that's what feels right for you.
I like what you said there. This is about making sense of yourself. That is what an assessment is, ultimately, isn't it? About making sense of yourself.
Well, it's the first start. It's the first step, isn't it? So, but it's only the very first step, and that's what I always try to say to people. It's not the end. It's the end of figuring out the puzzle, but it's the start of knowing the puzzle and being proud of who you are and knowing your pieces.
I could ask you so many more questions, and I wish I had more time to ask you so many more questions. But we are out of time today. So thank you so much for taking the time out of your schedule and out of your clinic to come and join us on the podcast. And I hope that what you've shared and the way that you have shared it, and some of what you have demystified for our listeners about an autism assessment, that it helps people who are listening. Thank you. If any of the topics mentioned in today's episode are of special interest to you and you'd like to discuss this further, you can book a one-to-one session with a peer guide on our website at autismcentral.org.uk. Autism Central would encourage listeners to do their own research and make informed decisions about any strategies or equipment mentioned in this podcast. Any advice or suggestions given by a guest or peer educator do not replace or substitute advice received from direct consultation with a qualified professional. The Autism Central podcast is produced by Autism Central and is the copyright of NHS England.